Thank you all for joining us today for our webinar on LIHWAP tribal implementation. My name is Sarah Dalgleish, and I'm a program specialist with the LIHWAP program. And with me today, I have Carlos Torres, who is also a program specialist and will be moderating our panel discussion today. And I also have Monica Toya, who is part of our Lux Tribal and Training Technical Assistance Program. Before I begin, I would like to encourage you all to introduce yourselves in the chat. We do have a packed agenda today, so in the interest of time, we're going to go ahead and get started. To start, there are a few housekeeping items. First, please keep yourselves on mute during today's webinar. If you have questions, feel free to put them in the chat, or else we will have an open Q&A session at the end of today's webinar, where we welcome you to ask questions of our panelists. Second, today's webinar will be recorded so that it may serve as a resource to those who are unable to join us today. And lastly, we're going to put a survey in the chat asking for your feedback about this webinar. We will issue a reminder at the end of the webinar, but I wanted to stress that we really value your feedback and the insights you provide on our training and technical assistance efforts. Next, I wanted to share a few LIHWAP updates. We have issued a number of important resources and guidance that we wanted to flag for you all. We will share this PowerPoint presentation after the webinar so that you can take a closer look at the resources linked here. But some of them include a recently published LIHWAP manual that can serve as a resource for onboarding new staff. And we also have guidance on providing emergency water bottle service and implementing LIHWAP without written water vendor agreements. The LIHWAP program specialist will go into further detail on these resources next week during the LIHWAP regional check-in calls. You should have all received an invite to the regional check-in calls, but if you did not, please reach out to your program specialist, or else you can find the Zoom invite linked here. For those in regions 1 through 7, your check-in is next Tuesday, November 15th at 3 p.m. Eastern Time. And for those in regions 8 through 10, your check-in is next Thursday, November 17th at 4 p.m. Eastern Time. Lastly, if you have not done so already, I encourage you to visit our website and review the materials, guidance, and resources available there. Again, this PowerPoint presentation will be made available to all after the webinar, so you can also explore our many offerings that we have linked here. And now I'll hand it over to Monica Toya to discuss Lux's Training and Technical Assistance Program.
Hi, everyone. Good afternoon or good morning for those that are in the West Coast. My name is Monica Toya. I am a program associate for the Tribal Training and Technical Assistance team at Lux Consulting Group. We provide training and technical assistance for tribes. So feel free to contact us with any kind of support that you might need. I am here representing on behalf of our Vice President, Nicole Oxendine, who sends her regards. So we do, as I stated, provide training and technical assistance. I am a previous programs administrator with some experience, or a little bit over 15 years experience with LIHWAP and CSBG amongst other federal programs. So feel free to reach out to our team for any kind of training and technical assistance needs. I believe the next slide has all our contact information. Thank you, everyone, for being here. Carlos?
Hello, everyone. Thank you for taking time out of your busy schedules to make it to this webinar. We think it's going to be really useful, and we're excited to have it. I want to introduce our amazing panelists today that are going to join us. I'll start with Trista Winnett. Trista Winnett is a program manager of the Choctaw Nation LIHWAP and LIHWAP departments. She has been in this capacity for a little over a year now, but previously worked as a manager in the Choctaw Nation Food Distribution Program for almost 30 years. Next, I'll introduce Stacy Mills, family who was born and raised in Kingston and near the reservation. She has been working for Port Gamble Sklam tribe since 2010 and is originally a family assistance case manager, then family assistance program manager, overseeing and coordinating a multitude of social services, and currently serves as a health services continuous improvement specialist. Hi, Stacy. Next is Pamela. Pamela is the program coordinator for the Bishop Paiute Tribe Social Services Department. She represents the Navajo Nation and enjoys assisting tribal members here on the Owens Valley Reservation. And lastly, we have Tammy Maynard. Tammy Maynard is an enrolled member of the Lumbee Tribe of North Carolina. She received her bachelor's degree from the University of North Carolina at Pembroke. She also received her Jewish doctorate in 2001 from the University of Michigan. She currently serves as the Director of Governmental Affairs for the Lumbee Tribe of North Carolina, where she provides program oversight and compliance to a variety of tribal programs. She has more than 20 years of experience serving tribal communities that are underserved. So those are our great panelists today. I'm super excited for them to be here. We asked them if they can come and talk a little bit about LIHWAP implementation in their communities. And so the way that this is going to work, it's going to be a 35-minute panel discussion, followed by a 20 minutes of audience Q&As. So please, if you have any questions, please feel free to add them on the group chat. But we'll start with our first question. And we can start with Trista. So Trista, please give us a 2 to 3 minute overview of what LIHWAP looks like in your community. Please include how large your tribe is and how much money your tribe was allocated. And if you own your own water utility and or how many water agreements did you have to make? Yeah, thank you.
Hi, thank you. It's nice to be here today to speak on behalf of the Choctaw Nation. The Choctaw Nation is the third largest tribe in the United States. We have over 200,000 tribal members, and our reservation covers approximately 11,000 square miles in southeastern Oklahoma. LIHWAP in our area it has really been an important addition to the services that we could provide for our tribal members. We do not own our own water utility company. Most of the utility companies are either city-owned or rural co-ops. So working with the utility vendors, has been our biggest accomplishment, I would say, getting with them. Originally, we were awarded $1,053,090 in LIHWAP ARPA funds and $1,347,875 in CAA funds. We were recently received an additional $190,802 in reallocated ARPA funds. We currently have 81 signed vendor agreements. We have approximately 17 more that we're currently working with. Of those 17, we do have 3 that are pretty sure they're not going to be able to sign the vendor agreement and abide by the terms and conditions of the grant. Luckily, we do have other programs within the Choctaw Nation that we can refer those individuals to receive, some assistance for their water. LIHWAP is just, like I said, it's been a blessing to our clients because there's not while the Choctaw Nation has programs to assist with utilities, there's not anything there that specifically said, we will help with water. So, and I honestly did not realize what the need is until we got this program.
Thank you, Trista. That's an impressive amount of water vendor agreements. Wow.
Yes, it's been interesting.
Yeah, inside I'm jaws dropping, but thank you so much for doing that work. That's such important work. We can go next with Stacy.
Okay, so going from very big to very small. I'm with Port Gamble Squalam Tribe. We're on the Kitsap Peninsula in Washington State. Our reservation is about, I want to say we've actually thankfully been able to get some more land back recently. So I think we're up to around 1,700 acres, but don't quote me on that. We were allocated $15,000 total between both fund sources for LIHWAP. We started in October of 21, tried to get a quick go on it. And we have about 1,377 tribal members. About half live on reservation. And then we serve the Kitsap County area as well for our tribal member households. So really small. We operate our own utilities on reservation. So our one vendor agreement is actually just with another department here on the tribe, on the reservation. And so we work closely with them. They've been great partners. We too are finding that we've always known there was a need for water assistance. It's actually come up a lot with our elders who are living on fixed incomes who have a really hard time keeping their water on. So this has been something we kind of knew we needed, but to have all the families coming in and really appreciative and grateful for the assistance too has been wonderful to see, and to be able to actually help them and not have to turn them away or turn them to county services or hope that someone out in the other communities can serve them because we hadn't been able to. So even though we're a really small program, we really feel like we've been able to make a big dent in our community and assist, especially elders, but a lot of our families here. So it's been a great opportunity.
Yeah, thank you so much, Stacey. You may be small, but mighty. And I know we have a broad array of different size tribes, so it's really good to get input from both large and small tribes. So thank you. We'll go next with Pamela. Oh, you're on mute. Sorry.
Sorry about that. Hi, I am speaking on behalf of the Bishop Paiute tribe. I currently serve the Owens Valley Paiute Reservation. We are a very small tribe. We currently have 175 tribal members that we serve here on the reservation. And we currently, I kicked off the LIHWAP program back in October 2021. And the fundings that we have received total from the American Rescue Plan and from the Supplement funding, the total that we have received is over 42,000. And pretty much how we started out our LIHWAP, we created the plan and we partner up with the LIHEAP program. We adopted the LIHEAP program itself as far as, policies and the rules, and the application did become as in 2-in-1 application, so that when tribal members came into our department to apply for services, it was a lot easier for tribal members to apply for LIHWAP as well. And as far as owning our own water system here on the Bishop Paiute Reservation, that was an easy, smooth process for us, as only having one vendor here with the, I work for the social service department in order for our work to be very efficient as far as payment. And with the one vendor, we did partner up with the public works. They are the ones who coordinate and work for the water system. And then as far as with our finance department, they're the ones that generate the water statements. So, just building that partnership between the three departments, we were able to, run our departments very smoothly. And so that's how we had generated our LIHWAP program, and we are very grateful and thankful for the fundings that have become available to us, and also receiving the additional amount that we received about a month ago. The additional amount that we received was a little bit over $2,000.
Thank you so much, Pamela.
Thank you.
Next, we'll go with Tammy.
Hi, everyone. Glad to have you with us on this webinar, and I'm honored to be able to represent the Lumbee tribe and talk about our water program. I, too, just like Tristan, Stacy, and Pam, am in shock about the need that our tribal members have for water. I, again, represent the Lumbee tribe. We have around 65,000 tribal members. In the service area that we serve, where our tribal members are eligible for these services, 43,000 tribal members could possibly qualify for our LIHWAP program. We too follow those same guidelines for LIHEAP and LIHWAP, so that when the client comes through the door and they're eligible for one, they automatically are eligible for the second part, which is the water, which eliminates barriers in them being able to, receive those services. We've received somewhere around I'm going to estimate 4.5 million in water funds for our tribal members, and they are utilizing this program. We have, one of the things that I've seen that we've done well, I think, is coordinating with our other programs, such as our housing program, to put in the infrastructure for people to be able to tap onto water so that that is made accessible to them, because we still have a lot of people who have well water that's not good water. So being able to provide them with this access and leveraging our resources has been great for our community. We have 29 water vendors to date that we're working with. We do not have our own water system. We rely on the cities, the counties, the towns to pay water. And it has been very, very simple putting those water vendor agreements in place. They've been glad to work with us, because what our community has recognized and they appreciate is that we're keeping people employed. The county recognizes, or the cities and the towns are recognizing that this is an economic catalyst for their entities. So they appreciate these funds that are coming in to the water department so that they can employ people, because a lot of them have had to hire new staff because of the program that we have in place. So it's been job creation that has been spawned out of these federal dollars in a time when we need jobs like this. So our community has been very thankful for the job creation and the help that we've given tribal members, and alleviated a lot of financial burdens in households that were really, really trying to decide how they were going to pay the mortgage, buy medicines, get children back in school under the circumstances that we're in. So thank you.
Thank you so much for that, Tammy. It warms my heart to know that not only is your community benefiting from water, but all of these job creations. So a lot of some of our tribes are on their beginning implementation stages of LIHWAP, and it's for a diverse array of reasons. But I wanted to ask each of you, what is a challenge that you faced, in thinking about when you were kickstarting your program, and how did you overcome it? And we can start with Krista.
So when I started in the LIHWAP program, LIHWAP was just starting up for us. I actually came in September of 2021. And at that time, the vendor agreements had already been sent out to a majority of the vendors. Those were coming back in about the time I started working here. We originally decided we would run LIHWAP just like we do LIHWAP. Our process was going to be the same. The award system, would be the same. So with our elders and disabled households and our households with minor children, we were awarding them the lump sum of $500. And that would just be on their bill, and they would have a credit, throughout the year. In October, when OCS, made everyone aware that there is a situation with us doing that due to people that have what they call the bundled bills, that have trash or other fees on those bills, we had to really stop and revamp basically our whole operation. We had to come up with a process that would allow us to still be able to help our clients that had bundled bills, and that would also work for the vendor companies. So with as many vendors as we have, and I realized very quickly when the vendor agreements were coming in that not all water vendors had received an agreement, because we are such a large area. And I think the past program managers said them to maybe the main ones. They didn't realize how many there were. So in January, we kind of took a step back. My team and I discussed, processes, how we can accomplish, our goals. And we decided very quickly that we were going to need a new vendor agreement. We reached out to some of our vendors and talked to them about, how could this work? We were told very quickly that most of our vendors do not have the software capabilities to split payments. So in other words, we couldn't send that $500 lump sum because they had no way of saying this money is only going towards water. So we decided, after talking with our legal team, that we would make a new vendor agreement and we would start conquering these goals on a month-to-month basis. So what we had to do was get with our clients, get with our vendors, make sure everybody understood, you know, there's only certain things that can be paid with this money, water, wastewater, sewer fees, and their fees. And we started the process of paying a portion of the client's bill on a monthly basis. And so that's when we sent out the new vendor agreements and started receiving those back as people would apply, and they may, you know, get water from a very small rural co-op that we didn't even know existed. So at that time we had to reach out to that vendor and, you know, explain the situation to them, explain the process to them, and get them to agree to sign the vendor agreement. And so we're constantly bringing on new vendors. We just brought a new one on this month because we didn't even know it existed until we got a bill, you know, from a client. So that was our biggest challenge in getting the program going. You know, we started off thinking, oh, we're doing great. And then it was a little bit of a backup and let's reassess. But after we got everything came together, you know, everybody worked together as a team, and we figured out this new process, got our clients on board, got the vendors on board, things have went smoothly after that. But that was one of our biggest obstacles, was making sure that we could still help everyone and also meet the terms and conditions of the grant.
Yeah, thank you so much, Trista. I can't even imagine how much work that was. But
It was, but it's rewarding. I'm glad that
Yeah.
it's done, and we are able to help our clients, and that's all that matters.
Yeah, truly. Thank you so much. We'll go with Stacy next.
I will echo too a little bit, the bundled bill situation. We, thankfully, because we are operating a little bit of a smaller operation, a smaller government out here, we were able to quickly kind of, you know, do an about face to solve that. And it just was a matter of working more closely with our accounts receivable, really, to make sure that the issue we had too was that they send out invoices and statements, and our clients would bring us the statement and then say, you didn't pay my bill. And we were like, but we go off the invoice that shows your water, wastewater broken down. And so just kind of that gap to kind of educate, I guess, our community members about, you know, why we were, even though they said, well, we qualified for $300, but you only paid $34 of the whatever, you know, and kind of educating them that that was the amount that was eligible for this program. So at the start, it took a good amount of sort of reinforcing that at every client interaction. And then also with our AR department. So that was one of our challenges as well, I would say, that we faced. Is just getting everyone on the same page with that and what that looked like, and that letting them know that they could continue to bring in a bill to continue to use their allotment, but for wastewater and water only, so that they still had to be. We also don't have it in our tribal code here. It states that if their utilities bill is behind, they can get shut off. So it does not have it in our code to say if their water is current, they won't get shut off. But if their garbage is, you know, we don't have it in our code that way. So in our vendor agreement, our utilities director and I worked together, and he said, you know, we understand your federal program and that it's here to help for water assistance. So we're going to work with our community on that. So we just had to have a close working relationship. And that was nice that they really heard me and were able to kind of work with me on that and guarantee that as long as they knew that clients were applying for our services, they wouldn't just shut off. So we did have a good bit where we would get the accounts receivable would be referring people to us. And that was awesome to see, because usually finance and us have a tricky relationship, I'll say. And so to see our finance department leaning on us a little bit more and letting our community know that they could come see us, and that if they had an appointment with us or if they had an application in process, that would stave off their shut off. So it was challenging, but I felt like we really came out with a better understanding of what everybody's part is, and we're able to really all work together to help our community. We also had challenges with our data system. We also were going to decide to operate it the same as LIHWAP. So I thought pretty easy standard, you know, for us, just kind of one more intake to add and it would be okay. And it was, and we have a really custom data system, so it's wonderful. But there were still little glitches. Also because we wanted to roll this out really quickly. We really wanted to get the assistance into our community. We knew that there were people that were facing shutoffs. As a matter of fact, our departments worked with us really closely in the beginning to really say these are the households we're worried about. So we knew we had people already facing those shutoffs, and we were already worried for what our community level of need was. So I just wanted to, I thought we could just get it going. And traditionally Port Gamble takes on programs and we do them first and we do them fast, and we like to think we do them really well, and we do. But I quickly learned in our database kind of the things that maybe weren't set up yet. But it was okay. We had some minor workarounds we had to do. Luckily, because we have one staff doing the intake, she was able to really mitigate those challenges with some quick workarounds and being able to code things just so that we would recognize it as LIHWAP and sort of have it conform to what we needed for LIHWAP. We still face ongoing challenges with report data and really mostly about our reports. Not our data input was good. We have a lot of data in the system, but because it's our first year, we haven't quite formatted reports to get that output. And I learned that quickly with our quarterly and annual report, trying to work on those. So we're still sort of up against reworking some of that with our reports to modify those.
Thank you so much, Stacey. Pamela. Oh, you're on mute again. Sorry.
That's okay. I got it. So one challenging thing that I came across regarding LIHWAP is, tribal members receiving your tribal distribution. So since we own our own water system here, tribal members were receiving deduction from their tribal distribution because they were behind on their water payment. And that became very challenging because I would have, Jane Doe come here. Hey, it looks like my distribution, I didn't get the full amount, which was really after the fact, which I had no control of, giving back their tribal distribution or trying to explain why her distribution was withheld. And so we became better at having those, communication between the applicant, the LIHWAP coordinator, and finance department to where, Jane Doe truly did, receive those deductions. Therefore, it's basically a done deal. So now that we have a better communication, it's a better flow to where I could tell Jane Doe that, there was a reason why your distribution was withheld because you didn't make your payment. LIHWAP can't give you the credit for it. However, you can come back in a month and reapply for the program, and we can help assist with your water statement. And that was the only challenging part that we have came across. But I feel like, we now have a better communication with the workflow of, processing the application, making sure that we don't have any upset tribal members who feel like they should still receive the assistance, even though they had the deduction towards their tribal distribution.
Thank you, Pamela. And you said you also said that you integrated the application so it can include LIHWAP and LIHEAP together, correct?
Correct.
And that made everything so much easier for you on your end?
Yes, it has made it so much easier just because, if Jane Doe came in and basically said, hey, I need electricity assistance, and then bam, at the same time, I will offer the water assistance, hey, we also have a new program that I like to offer you. Are you behind on your water bill? If so, then please, indicate on this application that you do need assistance with your water bill, and please provide me with your current water bill. Sometimes they may say, well, I'm sorry, I don't have a current water bill. And it's just that easy for me to get back to my computer and ask our account specialist, Pearl Vega, hey, Jane Doe came in today. Can I please receive her most current water bill? And she'll just email me a current water bill, and that's what I will pay off. Yeah.
Great, thank you. Tammy.
For us, I think one of the biggest challenges was looking at the number of tribal members that we had to serve. And we had such a large amount of money, and we have a large tribe and not enough resources to do those applications all in person. And we thought, how do we streamline this and help those that maybe are shut in, who need alternative methods? So what we did, we utilized an online portal. We allowed our tribal members the opportunity to come in and do the application in person. Everybody has a smartphone. We allowed them to be able to upload and email in their application because they knew how to take the photos and email it to us, upload. So that was good. And we realized, hey, let's utilize our outreach sites because we had community buildings throughout our territory. Let's go out into the communities one day out of the week. And we're still doing that right now. One day out of the week, we are at every location that we can find to go to. So Tuesday, Wednesday, Thursdays are always our outreach days. We go to the tribal members, and we do that just to eliminate the transportation issues that we see, because even with our county transportation, tribal members could come in here for an appointment and have to stay here all day long before they're picked back up to go home. So an application that could take 15 minutes, they end up here all day, and that's not fair to someone who maybe has been through dialysis earlier that morning or whatever may be going on with them in their life. Their time's valuable too, and we don't want them to sit in this office all day like that. But we also allow them to use our drop box. We put a drop box outside so that tribal members who want to just put their information in an envelope, they can just drop it off and we process it. And we are processing it quicker by utilizing our CSBG funds and our vocational rehab program. And you're probably wondering, what does that have to do with this? I try to figure out ways to maximize services. See, we won't need all this extra staff forever, right? You need them temporarily. So for those tribes that have CSBG programs, think about how you can do an on-the-job training program to teach young adults, maybe 18 to 25, that want to learn to gain some job skills. You could put them to work being intakes, being compliance officers, helping you to process these applications. Maybe they're part-time students in college, but they can gain some job skills along the way, and they can help you temporarily with the rush of applications that you get in. Or if you have a vocational rehab program at your different tribes, those tribal members who are coming in who have disabilities and they're looking for alternative methods or different types of employment opportunities. That's also a way that you could put some workers inside your program for those rush, when you're having a rush of clients or you're just really, really busy at certain times. And that gives them a job opportunity, to learn new skills as well. And they may say, hey, I really like this. I want to go to college to do this, or I'd like to explore a career in this field. So it helps in so many ways. Or even those college students, if you've got college students who need temporary work, it's a great way to hire people to help you get those applications processed. And what we do here too, like what Stacy said, I work closely with finance. I need those payouts going out weekly. So we make weekly payouts for our program. We don't wait 30 days. We make that pledge that day, but we make that payout. That payout is going out on that Friday. So our vendors are paid on Fridays. So they know when that payment's coming so that it can be credited to those accounts, because our tribal members will call to see if that credit's there. And that's the best way so that you don't get upset tribal members. And we have such high volume when we get upset tribal members, it really stops you from doing what you're supposed to be doing because you're dealing with complaints. So for those that are on the call that you haven't started your programs or you're trying to start, it won't be perfect at first. You're going to find things that aren't, oh God, maybe I shouldn't have done it that way. But that's what the Sarahs and the Carloses, they're here for that. The Rachels, they're here to help you. Sarah has been a great resource for my tribe. She's my grantee person that I call on and I say, hey, this is what's wrong, or I send her an email and she responds quickly to help you figure out how to get through the issues you're having. So it may not be perfect at first, but at least you're getting services to your tribal members. You're getting services to the people that need it, and they truly do need it.
Thank you so much for that, Tammy. You are really utilizing the resources, and I love it. And
I'm working the tar out of all the programs, y'all. I want everybody to work as hard as me, so I find a way to make everybody work.
Yeah, thank you so much. And I just want to remind everyone on the call, please, please, leave any questions you may have for the panelists. Drop them on the chat. We're getting close to that time of asking the Q&A session. So if there's no such thing as a dumb question, everyone, we can really benefit from the amazing panelists that we have today. And this is kind of a big reason as to why we have had this webinar in the first place. So Tammy, I know you covered a little bit about outreach efforts and how you're utilizing outreach efforts in your tribe, but can you talk about how in the beginning stages, what outreach methods kind of worked for you, and what you would tell someone that is kickstarting the program as advice in regards to outreach?
Yes, that is really huge. It is huge. For us, first thing I did, made 1 million copies of it and put it into tribal council members' hands, our tribal council, because they represent the districts. So I need you to put this out in the churches, in the schools, advertise in the schools, because those children usually know when mama and daddy are having a hard time, or or the school will work with you to make sure that that flyer is put inside their backpack and it gets home to mama and daddy, right? So that was a good way. Our local radio stations, they were phenomenal with doing free advertisements for us about this program. Of course, we are really, really big on social media here. So Twitter, Facebook, Instagram, that's your millennials. They're loving Instagram. If you're Facebook, you're not, that's the older group. We're in the older group, the older generation's into Facebook. So we have to know who we're targeting. And for us, it was everybody. So we've made sure we were utilizing our big radio, our radio stations like WKML, our country music. I mean, you name it. We were on every radio station advertising, getting us free advertising, stuff we're not having to pay for because we're a tribal government. We're trying to provide a service, and they were more than glad to help us. Our universities, because you have students who are in college who need these services as well. And we have colleges around us, so we were reaching out to them. So it was no matter how big or how small. And we do community meetings we go out into the communities physically and have meetings with our tribal members. And so for literally up until last month, I've been in every community for the past year just promoting this program. And of course, word of mouth is probably the absolute best, the best communication, the best way for it to spread, because if you get your services really quick, they're telling you'll have your credit next week if you'll go ahead on in there and do your application. And our tribal members have been spreading and sharing, and it has not slowed down. This program has been a flagship for us. I mean, we've served I think in 1 year, I think I told Sarah this, we've served like 12,000 tribal members in the past year that have come in, and that's not duplicates.
Wow, thank you so much, Tammy. I'm glad that you used that free advertising. Pamela, same question. What kind of outreach kind of methods did your tribe utilize? I'm sorry, you're on mute again. It's okay.
Outreach is very, very important. That's how you pretty much put the word out there that, you know, we have a new program in effect and what we have to offer for water assistance. So one of my number one outreach was our tribal newsletter. Every month I insert a LIHWAP flyer, and each tribal member receives the newsletter. And also social media is one of our main outreach. Our department here at Bishop Paiute Tribe Social Service Department, we have our own Facebook. So I try to be creative as possible with LIHWAP flyer. And I try to, you know, up it, make it pretty, and making sure that my contact information is current. And also we have the Bishop Paiute Tribe website. I have the LIHWAP plan available on the Bishop Paiute Tribe, and I also do have the LIHEAP and LIHWAP application available on the Bishop Paiute Tribe website. And so anyone who is in need of an application, I will refer them to our website, or I have it as fillable. I can email it out. And also I have attended 3, 4, 5 different community outreach events to where I have created folders with my business card, with the application itself, the LIHWAP application, and other programs that I oversee. You know, I make it available at my table and try to, you know, spread the word that we do have a new current LIHWAP program in effect, and if anyone needs help with paying for the water bills. So those are majority of my outreach that I've have done so far. And just basically flyers is my number one, you know, hit as far as outreach. And LIHWAP can actually pay for Canva if some of you are wanting to be very creative with making your flyer. And Canva is a very good program to make flyers in.
So much, Pamela. Stacey, same question. What kind of outreach efforts did yours have utilized?
Well, we have a weekly memo that goes out to our community. So it gets delivered to every house on reservation. It also gets posted, links to it from our social media and whatnot. So we always publish our programs in that. And so I added LIHWAP to it. And we also have a program part of the website. So we linked our LIHWAP application there so that folks could go link through our website to get to it. So it was advertised there as well. We also do, which we thankfully were able to start back up in 2021, was we did we do an annual resource fair for families. It's a joint venture with our tribal government, with our health services, and some other coordination programs. And so we put on out in the courtyard each year a resource fair with just many different things for folks. And I brought our applications to our table there and updated our information for our program there so that community knew to take a look at all of our programs as listed on our brochure. We have our brochures in a couple of different buildings. We did some outreach, early childhood education program through their Head Start. I believe it's a requirement of theirs, right? That they work with families to let them know of resources. So they actually had us come over to one of their monthly parent meetings and present with our brochure to let our families at Head Start know about the program. And I echo that too. Yeah, we were trying to reach, right, our elders, our young families, our single families, our, you know, everyone we could. So we really, nothing was hands off to us. We work very closely with all of our departments, all of our staff, all of our community members to really get the word out. And yeah, same thing. We, especially I think our elders, we have an elder living area where they all are in one neighborhood. And so once you get a couple of folks helped really with their bills, you know, they were quick to tell everyone, go see them. They took care of my bill, you know, and our elders have a reduced rate. So a lot of people just think it's not a big deal, but they struggle to pay it even at a reduced rate because they're on such fixed incomes. So word got out pretty quickly, especially with our elders. They come to elders lunch every day. So I know it was a hot topic over there. Our staff were encouraging them to come see us too. And we weren't as prepared before the pandemic, but during the pandemic, our emergency coordinator did make sure that everyone had a Dropbox to use. We had some other ways to do after hours applications, but the Dropbox has really been big. I posted a pickup box right next to the Dropbox with a big sign on it, directing them that they could pick up a LIHWAP hard application that was already printed for them in that box. So they could grab it from one box, fill it out, and put it in the Dropbox. And so that we could process it. If they did that after hours, we could process it the next day. And we do checks weekly. So it's pretty real time. As long as we get them by Wednesday at noon, we send the pledges over and the payment goes out that Friday. So we do it on a weekly rolling basis, and we try to really, get to those applications as quickly as possible. So in the outreach we do, we try to assure people that this is not some assistance that requires a big waiting period or anything like that. We tried to be really clear to let them know that we were here to help in real time, and we had some funds. We want to make use of them. We don't want to sit on the funds. We want you to have the help. So we really just worked as much as we could with our own other departments here to collaborate with them to make sure that whatever population they worked with, they would let them know. Our Natural Resources Department with our hunters and fishers had a really hard time during COVID because our boats were shut down. They couldn't fish, they couldn't harvest gooey ducks. So we had a lot of families that probably don't normally reach out for assistance. And our natural resources folks would say, go see them. They've got this new program and I think they can help you. And so with everyone's encouragement at tribal government, we really utilize that word of mouth through our own entities as well.
Thank you so much, Stacey. And Trista.
Yes, so the Choctaw Nation has, over the past few years, developed a member portal for our tribal members to be able to apply online for basically, I would say 75% of the services that we have. Those applications are available in this portal. Now, in the beginning of when we started LIHWAP in October of 2021, we were using paper applications. So our first goal was, we want to make sure our elders know about this program. And we automatically sent out paper applications to all of the elders who had received LIHWAP assistance the previous year. So we were trying to make it easier on them. They wouldn't have to contact us for an application. We would send it to them and get that ball rolling. And then, we could talk with our other categorical eligible groups. So we done that. We sent the applications to all of our community centers. We have approximately 22 community centers throughout the Choctaw Nation. And the elders all have a weekly luncheon on Wednesdays. And so we knew by sending out those applications, the people that didn't get one were going to find out about it because they will talk at those community meetings. We also, of course, supplied our councilmen with all of the information about the program because a lot of our elders, especially, that's where they get their information as well. We have a tribal website like most, and we posted the application there along with, information pamphlet, real short, not a pamphlet, but just a real short flyer, I guess you would say. We have a tribal newspaper. We put an ad in that tribal newspaper, and we run that a couple of times a year just as a reminder, that this program's still available in case you haven't applied. We also have our social media platforms like everyone else has mentioned, and we send out messages on those platforms. And we have tribal member emails that the Choctaw Nation has received emails from many tribal members, and they have the ability to only target certain members. So we made sure that we targeted the members that live within the reservation boundaries, and we sent emails to them and let them know about the program. Well, in December of 2021, LIHWAP went live on the portal. So we had decided throughout the next year that for the FY23 year, we were not going to do paper applications. The tribe's really pushing to go completely paperless. And so as part of that initiative, we stepped in and we said, okay, we want everyone to apply on the portal. In order to reach that goal, our tribal community centers have taken on, I believe, 2 staff that will roam from center to center. And I want to say we have approximately 18 staff members that go from different centers. So they're there throughout, certain days of the week. So if people go into our community centers, they will help them apply on the portal. We also have 2 computers set up here in our lobby. And when people come in to apply, we assist them with applying through the portal. So if they are not comfortable with the computer, it's okay. We can do it for them. We also have rep tools to where we can log on as a representative of the client and apply for the program. And generally, your client is sitting right there. They're just, especially our elders, a lot of them, they're afraid to even touch the computer. So we do that for them. We have also updated the social media platforms at the beginning of every fiscal year. So this year, a couple of days before October 1st, we sent out a member email, got on social media, updated the portal and everything to put these messages out that said, hey, don't forget October 1st, it's time to reapply for LIHWAP, and LIHWAP. But also having LIHWAP and LIHWAP being administered in the same building, it helped us a lot, because if someone applied for LIHWAP and we see that we do not have a LIHWAP application for that person, then we can reach out to that person and say, hey, did you realize we have this program to help with water as well? And some of them, they don't realize it, so they'll go ahead and get that application out, or they'll say, well, yes, but I have a well, so I don't need it. So then we can tell them, okay, well, you qualify for LIHWAP, but there's also other programs that have services that can help you too. So we kind of, without directly helping them with direct water, we at least help them with additional electric assistance so that they can operate that well. So just the word of mouth really is one of our biggest assets there with our outreach, because like, I forgot who said it, one of the ladies here had said, they're going to talk. The word gets out very quick.
Thank you so much, Trista. We are at 7 minutes out. I cannot believe it. Like it has the wealth of information, has been great. I was hoping to do one lightning round where it's a 2-part. It's one, just what piece of advice would you give to someone who's just starting up the program or who's in their beginning stages? Just one piece of advice. And 2, if you have any success stories or beneficiary stories that you would like to share. And we can start with you, Trista.
Okay. For the tribes that have not got started yet, or maybe you're just now getting started, I cannot stress enough how important it is to have a firm foundation on your process. Make sure that you have those good communication with all of your vendors. Make sure you have good communication, with your tribal members, because if you're not communicating with each other, it does make things a lot more difficult. As much resources as we have used to outreach this program, there are still some vendors that don't know about the program. And we actually have them, they will call us and say, well, one of your tribal members is a customer of ours, and they told us we need to contact you because they want help on their bill. So, that puts us in contact with other vendors. So just having that firm foundation and good relationships with your stakeholders, and those stakeholders, are anybody from, like you said, your finance offices to your vendors, your tribal members, your councilmen, that is going to help you tremendously. It helps you to get the word out about the program. It helps, everyone to understand your process with the program. You may have to do things a little differently like we did, with the bundled bills. And that is, to me, I can't say enough how important it is to have a good plan, and a firm foundation and good relationships with others, involved before you get started or shortly after you get started, because it will save you a lot of stress along the way and be able to help as many people as you possibly can.
Thank you so much. And then, yeah, for the rest of you, if you want to answer either like one piece of advice or like a success story, that would be great because we're nearing towards the end, sadly. Stacy?
Yeah, I also wanted to share that, make sure if you can to coordinate with the services that really do serve our families with the highest need. We had a grandmother taking care of a grandchild that her Indian child welfare case manager reached out to us, and we really worked together. We honestly couldn't pay her whole bill with the allotment she got, but we were able to tag team it, and just like Tammy was saying, utilize other resources and pull everyone together. So we paid the maximum that we could pay, and child welfare paid some assistance as well, and some other programs that they were part of. So we really depend on our other programs serving the neediest families as well. So if we know that we're placing a child in someone's care, we always try to look out first for what benefits they might be eligible for, because we really want to secure that household and that placement for that child to, really reduce children having to move home to home. So we really value those partnerships and make sure we're getting those families in the household. Grandma was so very thankful and overjoyed that she had never had water assistance before, and that we finally had something that could help her. And her bill had just climbed and climbed and climbed, and we didn't want her to get shut off. We didn't want her to lose her grandson. We didn't want, any of that. It goes south fast, right? So that was a really beneficial assistance for that family.
Thank you so much, Stacy. And quickly, Pamela?
So people who are just now implementing their plan, I like to advise to pay attention to your plan. One of the things that I highly encourage for you to pay attention to is your estimated funding allocation, knowing how much you're going to spend. And, pretty much for this main key piece is to outreach to, to spend your LIHWAP funding is, to outreach. It's very important that you do a lot of outreach in order to spend your fundings from the LIHWAP funding. And so there is a small indicator in your plan on the estimated funding allocation 1.4. There is a little piece in there that will indicate outreach eligibility termination. So if you just want to up your percentage a little bit, that might be very, very helpful. And that's the only tip I have. Thank you.
Thank you, Pamela. And Tammy?
I think I'll share a scenario that I had last week. This is it kind of puts it all in perspective, why we do what we do. I had a tribal member come in last week. Her husband had just died. Her daughter had died in a tragic accident. She had her grandson. And this lady wasn't, I'm 48, y'all. I have an 11-year-old. It traumatizes me when I see people my age with grandchildren, because I realize I'm older than I think I am, okay? So she didn't look much older than me, and she's a grandma having to raise her grandchild, but she works every day. This isn't someone, she's working hard every day, but life has just thrown her some lemons, right? Bad things, and she's trying to make the best of it. And she walked in here and she said, Miss Maynard, and she shows me the picture of her water. She had well water at the time, and she showed me a picture, and I felt so guilty that I could go home and have good, clean water, because look at Trista's desk. Imagine that's what your water looks like. That's the color her water was, and she had it on the stove, y'all, trying to boil it so that she could wash her grandson so he could go to kindergarten the next morning. She's eating. This is what she's using. This program is the reason why we were able to put in to pay her tap-on fee to the county water. And my housing program stepped in with NAHASDA and ran the lines, paid for the construction of the line to the house. She called me back And this lady is a surgical, some kind of technician at the hospital. She didn't make a whole lot of money. She qualified for the program. But this lady was able to go to work this week, and she called me this week to tell me that she had water. And she sent me a video of the water coming through the faucet, and it was nice and clear. And she was so overjoyed with that small thing. You know, we take that so for granted that we have clean water to drink. And this lady, this is what this program. So I thank HHS, I thank the federal government, I thank the department for thinking about a program like this and what kind of impact it truly does have on the lives of people, not just tribal members, but on the lives of people, so that they can just have a quality of life, a daily quality of life. That little boy going to kindergarten is going to have clean clothes now because she wasn't able to wash clothes at home. She was having to go to the washer to wash her clothes, and she was having trouble having to buy water to be able to eat and do those kinds of things. So we as teams alleviated a burden in that family's life. So thank you.
Thank you all so much, and thank you so much, Tammy, for that story. This program would not be possible without the work that you all do every day. And for everyone on the line, thank you so much. We really appreciate all the work you do, and it's grounded in help for our community. So unfortunately, time is up, but I hope that you all have a wonderful rest of your day. We'll be sending out the PowerPoint and also a link to our survey that you'll hopefully fill out to see how you all like this program. But yeah, thank you all, and until next time.